Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This webinar where we're going to talk about Lyme disease. So many of you are familiar with last week. We had a big technical breakdown, and I'm hopeful that tonight things are going to go okay, at least in terms of the live webinar. But it does look like we've got a problem in that my connection to record this with YouTube somehow is not working tonight. And I've been spending the last half hour trying to get that to happen, and it's not going to. So for those of you that are listening in, again, there will not be a recording of this, so you may need to take notes as we're going through it to record what is happening, okay? All right. So let me just see. I'm getting some messages here. It's like I'm hearing, it looks like people are being able to participate. And actually, I can see on my my screen, I have another computer in here to make sure that it reconnected today too. So for those of you that are new, welcome. And those of you that are back again, I'm glad to see some familiar names here. The way you participate is to write your question to me, and you can find the spot to do that on the right-hand side of the screen at the bottom. The only thing I ask is as you're writing your questions, don't make them too long. If they get to be too long, I'm not going to be able to post them and read them during the webinar, okay? And I will read them so that people can hear them. Although if you are participating here, you should also be able to see them post on your screen as well too, okay? All right, so I think without any further ado, let's go ahead and get started here. Christine says, so far this is good. This is good. All right, good. All right, so let's go ahead and get started. Hello, Sarah. Let's see. So how do your treatment protocols for Lyme disease vary for young children? Do you use the same antibiotics and herbs, but at different doses? Looking for some guidance on where to start with a 2-year-old with mild symptoms. Thanks for all you do. All right. So in terms of my approach for children that will be about 2 years of age, I do work herbally with some of the children, although my preference at that age is to work with prescription antibiotics because we have more track record. I'll just say that to begin with, okay? But in general, when trying to consider what herbal antibiotic doses to use for a child, again, the herbal antibiotics I like working with would be a cat's claw and Otoba to treat Lyme, the Lyme germ. I like working with Sida acuta and Hutinia to treat Bartonella, and to treat for Babesia, I like working with something called Cryptolepis. Okay, those are the main herbs I like using. And those are all okay to use in children. Again, I usually prefer in children to work with prescription antibiotics because I think there's more of a proven track record at that age. In general, the way that I make an adjustment for doses in children is to look at their body weight and look at what percent that is of a 150-pound adult. Okay, so most of the dosing I've come up with would be an average dosing. If you see what I write in my site, it's going to be based on an average 150-pound adult, basically. All right. So if you've got a 15-pound kid, for instance, they're going to need 10% of the dose that I recommend for adults. Okay, that's just a general rule of thumb, and so that'll get you in the ballpark in terms of how you do it. Okay. All right. So anyhow, those are my thoughts. Good luck to you, Sarah. Okay, so let's see here. Next question. So this next question is from Leslie. Hello, Leslie. Let's see. Hi, Dr. Ross. Does Cemento work on its own to treat Lyme or only with Banderol? Do you have to be at the full 30 drops to start seeing improvement, or does it start to work at lower dose while building up to 30? I'm at 13 drops morning and evening that I've built up to over 3 months and not seeing any change in symptoms. Thanks for the session. You're welcome. All right. Actually, no, I just realized something. We may still be having a recording of this. I'll see if I can get one up tomorrow. But anyhow, if you're listening in, I would take notes in case the recording is not going to be able to go through here. Okay. All right. So let's see. All right. So in terms of dosing on the Cemento and then and whether it can work on its own or not. So Cemento, everyone, is Nutramedix's version of cat's claw. Okay. And a cat's claw can kill Lyme. I generally don't find it to be effective enough alone. So I have liked working with Otoba bark, which is also known as Banderol by Nutramedix. And I like working with it because there's Petri dish experiments that show really good benefit. The Petri dish experiments that came out, I think about 7 or 8 years ago now, showed that these two herbs used together can kill both spirochete and cyst Lyme. Those are the two forms that Lyme live in a person. And in addition, these two herbs together wipe out 100% of biofilm, the slime layer that covers Lyme germs that can block out the immune system and block out herbal antibiotics. So I like using the two together for those reasons, okay? Now, I have used cat's claw alone before, but I haven't found as good of results. If I've got somebody for some reason that cannot tolerate the Otoba bark, which is the Banderol product, then sometimes I will mix my cat's claw with teasel root. And for teasel root, I do also like to work up to the 30 drops twice a day as a target dose, okay? And you can take it at the same time as the cat's claw. Again, the Cemento is what you're calling it here. In terms of dosing, my target dose for adults on most of these herbal antibiotics is to try to work up to 30 drops twice a day. Okay, that's what my target dose is, okay? But what I can tell you about that is that's based on having a person that has normal functioning detox systems, okay? So what happens, what we're ultimately interested in is, do you get enough of the antibiotic herbs in you to kill? All right. And what that's determined by is how much do you take and how rapidly is it cleaned out? Okay. So how much you take will raise it in your blood. And then how quickly it comes out will determine how it stays there. Okay. So if you've got somebody that has impaired detox, or if you're a person that thinks you might have impaired detox or is medicine sensitive in general, that usually implies some type of a detox problem, meaning you cannot clean out the herbs as quickly as somebody that doesn't have a detox problem. So if you cannot remove them as quickly, that means you may not need to put as many in you to get up to an adequate level that does a good kill. All right. So there are some people, for instance, I had a patient that I managed for both Lyme and Bartonella a number of years ago from Canada that we were only able to get up to 2 drops twice a day on the Sida Okuda and Hutania and 2 drops twice a day on the Otoba and cat's claw. And that person actually got well. But she was extremely medicine sensitive across the board. And I took that as a sign that she probably had impaired detox, therefore impaired ability to remove these medicines, okay? So what I'll do if I've got somebody that keeps running into a wall, they keep having sensitivities at lower doses of the herbs, then in those kind of situations, I am going to I'll just leave them at a lower dose and see what happens. Okay, so it's okay to take these at lower doses as long as they're working. All right. Okay. Thanks for that question, Leslie. I appreciate that. And good luck to you. All right. Looks like we got the next question here from Elizabeth. And let me just check in here. Okay. Looks like we still have people joining us here. It looks like a good turnout tonight. It looks like the webinar is working. I'm just double checking after what happened last week. I'm actually going to close my computer here too. All right, so I had a computer over there that I was checking to make sure, given last week's disaster, that we actually had people showing up and that it was being broadcast, but it is. All right, so yeah, okay, so hi, Elizabeth. Let's see. Resubmitting because I was not able to get into the last webinar. I know we had a big technical failure last week. I found the attached tick on June 5th, went on doxycycline 3 days later, but had an anaphylactic allergic reaction response. After 12 days, I went on amoxicillin for 3 weeks and rifampin for 7 days. I tested positive for Lyme and anaplasmosis 5 days into this antibiotic course. After that, have been on herbs, Samsura tick formula, curcumin, magnesium, liposomal glutathione. After about a month on herbs, I got a horrible stomach bug and was on vancomycin for a week. I still have intermittent pain, mostly in my arms, bouts of severe fatigue, and a weird vibrating sensation, particularly when I lay down and mostly in my arms and chest. Do I now have chronic Lyme? What would you suggest my next steps be? Okay. So this gets into a semantics issue. Okay. All right. So first of all, acute Lyme is that kind of Lyme you get related to recently having a tick bite. Okay. And chronic Lyme is what happens when you got acute Lyme and it wasn't adequately treated during the acute period, or it was treated, but then down the road, the symptoms come back. Okay. So to put this in context, if we look at the Infectious Disease Society of America, in their old guidelines, they've got some draft new guidelines, but in their old guidelines recommended 3 to 4 weeks of antibiotics. And that's the standard that most doctors do. And that's doxycycline is the main one. But if we look at what the failure rate is on that, we find that when people use that 3 to 4 weeks of antibiotics, about 15 to 20% of people, that doesn't work, and they develop ongoing symptoms. Okay, and that's what we call chronic Lyme. Now, in a situation like you're in, where you had Lyme that was treated, but it's still related to the acute antibiotics, you are still having ongoing symptoms. I would still classify this as acute Lyme that was not adequately treated, still in the early period. I would call this acute Lyme. And the reason I would call it acute is you did get started to get treated, but you just didn't have an adequate treatment to get rid of it. It's not clear to me if you were to get an adequate treatment still in this earlier period of having Lyme, if you might go on to eradicate it and not go on to develop chronic Lyme. Okay. I generally call chronic Lyme something that is there if you haven't had adequate treatment and you still are symptomatic at a year or more. That's when I start calling it chronic Lyme. And I would look at this more as a failure of acute treatment, but you're still in the acute period because you never got rid of it entirely during the acute period. So I would reconsider treating. Okay. That's how I would classify it. All right. Good luck to you, Elizabeth. Hello, David. Let's see, for your PANS Bartonella patients that are not improving on multiple tier 1 antibiotics for 12 months, that would be rifabutin, minocycline, clarithromycin, and oregano oil. Do you advocate autoimmune, immune-mediated, or immune suppressive treatments like steroids, IVIG, plasma exchange, etc., per PANS guidelines in addition to antibiotic therapy targeting the infection? Thank you, Dr. Ross, for your recommendation. Okay, so in my system of classifying things, PANS is not Bartonella. Bartonella is another type of infection that can trigger psychiatric symptoms, but those are related strictly to the Bartonella. PANS, on the other hand, the way I classify it is PANS is going to be related to probably a strep infection that triggered psychiatric illness. So I just want to tell you that, okay? So if it is Bartonella triggering your psychiatric issues, I'm not a supporter of using steroids, IVIG, or plasma exchange, or even the biologic that you have listed here as well too, okay? I'm not. On the other hand, if you test positive for strep, and you've done an extensive treatment for Bartonella and you're not getting better from the strep infection, then you might want to consider those. But I would make sure that you have done adequate treatment for Bartonella. And to figure that out, because I know that's going to be your question, is how do I know I have? Given the extensive treatment you've had here, I'd almost need to talk with you in person to figure out whether I think this is an adequate treatment that you've had, okay, for the Bartonella side. But in general, for Bartonella, I don't like using immunosuppressive agents because I think it makes it harder to ultimately get that germ out. Okay. All right. Thanks for the question, David. Good luck to you. Hello, Sarah. Let's see. What do you find to be the most effective treatment for Candida when someone has symptoms throughout their body? Vaginal itching, stomach discomfort and gas, breakouts, white tongue, light sensitivity, etc. Thank you. Okay. So I want to make a distinction. Okay. I like the way you said has symptoms throughout the body. Okay. So when you have too many yeast in the intestines, it can cause systemic symptoms, but it doesn't mean the yeast is living systemically throughout your body. Okay. This can still occur from yeast living in the intestines. All right. So what's the relationship between that and all the stuff you just said? Well, if you have too many, so in our intestines, we normally have good bacteria, viruses, good parasites. Yep, even parasites, healthy parasites can live in our intestines. And there's yeast in there. And they all kind of live in harmony with each other, okay? Now, if for some reason, because of stress or being on antibiotics, sometimes being on steroids, sometimes being on hormones, it can lead to an imbalance where you get too many yeast living in the intestines. And so that's yeast overgrowth, all right? Now, yeast overgrowth leads to problems for a number of reasons. Number one, when you have too many yeast, the immune system will see them, and the immune system is going to react by making a bunch of inflammation chemicals called cytokines. All right. Now, as many of you know from my reading my Lyme disease information site, and also listening on these webinars, when you have Lyme symptoms are actually symptoms of having too many cytokines. All right. So what are these cytokines? Well, cytokines are chemicals made by white blood cells, certain types of white blood cells, when they see an infection. And they're made to turn on the immune system. So on the one hand, cytokines are good, okay? They result in more white blood cells being made. They draw those white blood cells to where the infection is, and they help those white blood cells work better, okay? That's all good, right? But if you have Lyme, or if you have mold toxins in you, or if you have too many yeast, the immune system will try harder and harder to get rid of those problems. And eventually it will make too many cytokines. And it's too many cytokines that give you a problem. So too many cytokines make it so you can't think, give you fatigue, make you hurt all over, interfere with how your hormonal systems work, disturb your sleep. You got the picture, right? What we call Lyme symptoms are really too many cytokine symptoms. And those too many cytokines also can occur when you have too many yeast. So they can look a lot alike, actually, okay? All right. In addition to triggering too many cytokines, when you have yeast in your overgrowing in your intestines, they release toxins. And some of those toxins can act on your nervous system. So they're neurotoxins, okay? And also some of those toxins will interact with your skin as they get into the bloodstream and eventually get to your skin, leading to pimples and rashes and acne, for instance, too, okay? So that's how you get systemic symptoms from having too many yeast living in your intestines, okay? All right, the other symptoms you get with too many yeast in your intestines is you can get gasiness and bloating. You might get white patches up in your mouth. You might have difficulty swallowing if it's actually growing in your food pipe, okay? And also, if you've got too many yeast living in your intestines, that sometimes will lead to too many yeast living in your vagina if you're female as well, too, so you can get itchiness and discharge, okay? All right, so what's the best way? Well, I have a whole article about how do you treat too many yeast, all right? But my go-to treatment, my first line treatment is to use nystatin coupled with fluconazole. Nystatin is 500,000 international units 2 times a day. And fluconazole is also known as diflucan. I like using a 200 milligram pill 1 time a day. Okay, now diflucan's your bazooka. It's the main agent that's killing the yeast. But I include nystatin because yeast have a tendency to learn resistance to diflucan unless you have nystatin on board. Okay, that's at least why I do it. All right. Now, nystatin does not have any systemic toxicity. It stays in the intestines. It is not absorbed into your bloodstream. Diflucan, on the other hand, rarely can lead to some liver inflammation. Although, to be honest with you, I've been doing treatments this way with nystatin and diflucan for probably about since 2002, maybe, I think is when I first started doing it. And at first, when I started doing this, I was testing everybody's liver each week to make sure that they didn't get inflammation from the diflucan. I never saw it occur. And so I just don't see it as being something that can lead to inflammation. Okay, so now nystatin diflucan I find will work in about a month to get yeast out within a month. And it works about 90% of the time. Okay, that's my favorite initial one. Okay, now there is one other treatment that has a greater chance of working, but it takes 2 months. And that is to use something called Amphotericin. And Amphotericin has to be made by a compounding pharmacy. And it will take about 2 months to work, but it does work up to 95% of the time. And it tends to be what I use when everything else is failing. It's my last medicine. I kind of keep it in my back pocket in case I need something else to try. Okay. Now, I want to warn you about amphotericin. It has to be made by compounding pharmacy. And the reason it has to be made by compounding pharmacy is the manufacturers only make it to be given in an IV. All right. And that is because it's not absorbed in the intestines at all. It stays in the intestines. It never gets into the bloodstream. Or if it does, it's like microscopic amounts. Okay. All right. It's approved to treat blood yeast that's living in your blood and in your organs. All right. And in fact, we use it, for instance, with people with HIV and AIDS or patients that are on chemotherapy that have a lot of immune suppression going on, where we actually have evidence from cultures that they have yeast living in their body, okay, or in their blood or in their organs. All right. Now, if you start reading about amphotericin online, you're going to see some horror stories about it. And in fact, in medicine, when I was in training, we used to call it amphoterrible B instead of amphotericin. That's only when it's given in an IV form. And in an IV form, it can have a lot of organ toxicity. Okay, that's why we call it amphoterrible. But in an oral form, it's either not absorbed or you have minimal absorption, and it is completely safe to do. Okay, all right. So again, my frontline treatment would be nystatin diflucan, works 90% of the time, takes about a month. But if the other thing that has greater chance of working that I will use if other things are failing is the amphotericin B, 200 milligrams, 3 times a day. And most people need it for at least 2 months to get things all the way under control. Okay. All right. So let me do a quick screen share here for you. All right. So this is my Lyme disease information site. This is my online guide where you can read about any thoughts I have about most topics related to treating Lyme disease. And in here, I actually have a whole chapter that's just on yeast, okay? So if you're looking for information about how do you figure out if you might have yeast, take a look at this article here called A Silent Problem. Is it yeast, okay? And then take a look over here at this article called Kills Yeast, a Brief Guide, where I lay out how do you treat yeast. And in here, there's a video, and I talk about using nystatin and diflucan. And then down here, I talk about the amphotericin B that I was just describing to you, okay? All right. Sarah, thanks for that question, and good luck to you. All right, let's see here. Hello, Crystal. Let's see. Hello, Dr. Ross. I hope you're well. I am. Thank you. Let's see. What do you do when your patients are allergic to Hootenea, Sida acuta, and Cryptolepis? I'm on antibiotics and methylene blue to treat Bartonella and Babesia, but unable to tolerate any of the herbs except liposomal oil of oregano. From your support protocol, I get an itchy throat, runny nose, and after a couple of days, I start to cough and wheeze, as I do with my allergies to cats. I've tried herbs and alcohol, glycerin, and powdered form, and I react the same. Should I try to take allergy medication to stop reactions and still try taking the herbs? Thanks for your time and all you do for the Lyme community, Crystal. So Crystal, unfortunately, when you have an allergic reaction, you have an allergic reaction. And when it comes to herbs and drugs, you don't want to play around play around. That's probably a bad way of bad term to have used, but you don't want to take them and try to push through it, because once you are sensitized to something with an allergic response, as you keep taking, that allergic response can get stronger and stronger and could eventually lead to super strong allergic reactions, which is something we call anaphylaxis. So I probably just would not take the herbs. And in situations like this is where I have to have somebody take prescriptions as their germ killers. Okay, so I'm glad to see you can use the oregano oil, but clearly these other agents you shouldn't be using. And there's not a workaround other than to actually take the prescription antibiotics that you're using to kill the germs. Okay? All right. All right. Good luck to you, Crystal. Thanks for the question. Hello, Margaret. Let's see. How do you know when to stop taking cholestyramine as mold treatment? The symptoms of mold are so similar to Lyme. So to explain this, everyone, Margaret's asking a good question. So mold toxicity illness can look very similar to Lyme disease. All right. So let me talk real quickly about mold toxins, and then I'll answer your question. So there's 25% of all people that when we get exposed to mold toxins that are growing behind our walls from the mold living behind them, for instance, if we breathe in the toxins that are made by those mold species, those 25% of the time they can get trapped in people. Okay, or I should re-say that. There's 25% of people that will have a problem where they can get trapped. 75% of people have no problem at all. Okay, so what happens is 25% of people have a genetic predisposition to not being able to have their immune system break down mold toxins. What happens in 75% of people is your immune system will see a mold toxin hanging out in the blood that you breathed in and that got absorbed into the bloodstream. Some of your white blood cells will see those mold toxins and they'll tag them. And they're tagging them so that other parts of the immune system can come in and break those mold toxins down. So 75% of us, our systems do that. We can go walk through a building of mold toxins and never have a problem at all. Okay. But 25% of people, those mold toxins can get trapped in you. Okay. So one of the ways to see if you have mold toxins in you is actually measure them. And one way we can measure them is to do a urine test to see if you're peeing out excessive amounts of those mold toxins. And so I like using one of two labs. One is Great Plains Lab out of Kansas City, and the other lab is Real Time Lab out of Texas. They both test in two different ways. The Great Plains Lab is using a process called chromatography, and the lab in Texas, Real Time Labs, is using an antibody linked reaction method called an ELISA test. Okay, so just two different techniques without getting into specifically why one might be better than the other. Just realize that. Okay, so when I have a situation where I've treated somebody for mold toxicity and I want to see, am I done? What I will do is I'll do a urine test to see, are they still peeing out a lot of mold toxins? And if they're not, then I think that they're probably, the reason they're still staying sick is from the Lyme. Okay. Now, again, the reason Lyme and mold toxicity can look the same is based on what I was talking about earlier tonight when we were talking about yeast. And that is both Lyme and mold toxins, and also too many yeast in your intestines trigger cytokine excess. Okay. And so it's all those excess cytokines that give you symptoms that have these conditions looking the same. All right. So anyhow, see if you're done, get a urine mold toxin study. Okay. Now, there's two different schools of thoughts regarding mold toxins. There's a group of physicians that were trained by a physician named Richie Shoemaker. Dr. Shoemaker was the first person to describe mold toxin illness. And his ideas, although were the foundation of mold toxicity, a lot of his ideas are out of date. And a lot of the practitioners that still follow his way of treating mold toxin illness are out of date. That's my opinion. Okay. So in Dr. Shoemaker's way of looking at mold toxin illness, he has his practitioners that he trained measure a bunch of inflammatory chemicals like C4A, TGF beta 1. These are all tests that Dr. Shoemaker trained his physicians to do. And so if you're using a physician that is measuring a bunch of inflammatory chemicals in your blood to see if you have mold toxin illness, they're following the Dr. Shoemaker way. Okay. Now, all those inflammatory chemicals may go up when you have mold toxins, but also Lyme can trigger them to go up. So I don't agree with that way of measuring to see if you have mold toxin illness. I liked measuring the urine to see if you actually have it in you. And there's a whole group of us that have broken away from the Shoemaker way of looking at things. And we think you ought to go ahead and see if you really have the problem, see if you really have the toxins in you by doing the urine test. Okay? All right. Thanks for our question, Margaret. Good luck to you. All right, let's see. This is from Sandra. Sandra says, have you heard of Lyme or other tech illnesses causing elevated GAD65 autoantibodies? I'm not even familiar with what a GAD65 is, so I'm sorry, I'm not familiar with that. Okay. Hello, Rhonda. Let's say hi, Dr. Ross. Thanks for all your help. When treating for Bartonella with 600 milligrams of rifampin, 300 milligrams azithromycin, how do you know when it is time to stop using the antibiotics? Do you continue for a period of time after symptoms have eased? Do you stop all antibiotics at once, or do you gradually reduce? All right. So, Rhonda, without knowing your specific situation, I can't answer specifically for you, but I can give you some guidelines, okay? So generally, when I'm trying to, and on average, when you have Lyme and Bartonella, an average treatment length is about 4 to 6 months. Okay, that's on average. Okay, and what I try to do, determining how long I'm going to treat, is I try to follow the symptoms that somebody has that could be from Bartonella. So as part of my treatments, I'm always trying to figure out, okay, which is Lyme causing this or is Bartonella causing this? Okay, so the symptoms that often come from Bartonella are pain on the bottom of the feet, neuropsych issues, and by that I mean things like ongoing anxiety or depression or hallucinations, okay? Some people will get neuropathies out of their Bartonella, and that can look like muscle twitches. It can look like seizures or pseudo seizures where you get evaluated by a neurologist. It's clear that to anyone looking at you, they're having seizures, but they don't see it on their electrical EEG, those wires on their head measurement. Okay, so I call that pseudo seizures, or you could call it non-elliptiform seizures. Okay, those can come from Bartonella. Bartonella can give a lot of numbness. It can sometimes give nerve pain. Okay, but the big things I like to follow are more, especially if somebody's got anxiety or I like to follow that. And often you'll have a clue that Bartonella is under control when the anxiety goes away. Okay. Or if they have pseudo seizures or non-elliptiform seizures or seizures in general, if those go away, that usually means you got Bartonella under control. So you kind of got to follow your symptoms that led you to think you might have Bartonella, see how they resolved. Now, they may not all go away because some of those symptoms have overlap with Lyme can cause, okay? But I just kind of get a sense of, are they gone? And I want them gone for about a month, maybe even up to 2 months, and then I'll stop my Bartonella treatments, okay? All right. And then when I stop all at once. I don't do any gradual reductions on that. All right. Thanks for your question, Rhonda. Hello, Heather. Let's say hi, Dr. Ross. I have POTS and I haven't found a medication that I can tolerate to treat it. I have noticed that when I take Sudafed, most of my POTS symptoms are drastically better. I've read that Sudafed constricts blood vessels. Is there any herb that would have a similar effect? Also, is there a specific lab that you recommend for sex hormone testing in a woman, or is blood test through a family doctor accurate? Thank you. So let me answer a number of things here. So Sudafed is made up of pseudoephedrine that can constrict your blood vessels, okay? Herbally, the only thing that you might find that could relate to that would be something called ephedra. But here in the States, most of the ephedra has been removed from products. All right, so we're not able to really get that. And you have to be careful using it as well, too. But that would be the herb that might have a similar effect. Let's see, specific lab for sex hormones. You know, I don't do any specialty labs. I'll usually, in terms of sex hormones like testosterone, estrogen and progesterone, we'll do a blood testing at the lab. When it comes to estrogen and progesterone, those levels are determined where a woman is in her cycle. And I usually like to measure them on day 3. And by day 3, I mean the third day after your period starts is day 3. Okay, day 1 is the first day your period starts. And I also like to measure them on day 23. Okay, so day 3 and day 23. Okay. In one of those tests, I also like to get something called a free testosterone because testosterone also is made by the ovaries. And if it's low, could contribute to low energy and could contribute to low sex drive, for instance, too. But you could either do that on day 3 or day 23. Okay. All right. Thanks for that question. Good luck to you, Heather. Hello, Joanne. Let's see. My son was recently diagnosed with tick-borne relapsing fever, Borrelia species with an IgG, and tick-borne relapsing fever, Hermsii, IgM. This is after he was diagnosed back in early June with Lyme burgdorferi and then in late September with Bartonella. The labs are medical diagnostic laboratories and IGenics, which are reputable, but the continual new discoveries have us perplexed, and he is still sick. Rifampin 2 weeks now, and Doxy 3 weeks after stopping soon. Any thoughts on this? So the one I'll comment. I guess it's going to be hard for me to comment on how to treat his illness because I don't have enough. You haven't told me enough about what his symptoms are other than saying he's sick. Okay, but the testing that you have had done is antibody testing. Okay, IgG and IgMs are antibodies. And the way we're trying to figure out if you might have these illnesses is we're trying to see, has the immune system reacted, try to get rid of those infections by making antibodies, okay? Now, antibodies are proteins made by the immune system, and what they do is they attach to a germ. And once they're attached to the germ, they kind of act as a signaling device that says, hey, I got a germ, and other parts of the immune system will come in and gobble up that germ. Okay, that's kind of a simplified way of looking at what antibodies do. Now, keep in mind, antibodies are not the only way that we attack germs or that we can see if a germ is being attacked, but it's one way. The other thing that we have is immune cells that will turn on to attack germs, and that's called cellular immunity versus measuring antibodies as a way of checking on what's called humoral immunity. Okay, those are the two terms that we use in medicine. Okay, all right. Now, if you have infections and if you have immune suppression related to those infections, sometimes your immune system's ability to make antibodies is limited and you may not have an immune reaction. All right. But as you start treating those infections, as the immune system starts turning on and has less suppression from those infections, sometimes you'll start developing antibodies that will show up. And that may be what's happening here is as you've treated, even though he may be sick, it may be still that the immune system is starting to turn on enough that it can start making antibodies against these infections that are now starting to become positive. Okay? All right. Thanks for that question, Joanne. Hello, Pam. Let's see. How likely am I to relapse from Babesia after all my bloods have returned to normal? I finished 6 weeks of atovaquone and 3 weeks ago. All bloods are back to normal except high BUN level and some elevated liver enzymes. Thank you so much for your help. So there is not a good test that shows that you are done treating Babesia. Okay, I don't use testing to show that to me, all right? So if you've had Babesia testing, the way that it could have shown up is antibodies, or IGenics does a test where you can actually see the Babesia on the microscope using a fluorescent tag that identifies the germ, or we call that a FISH test. FISH stands for fluorescent in situ hybridization. It's a mouthful of words, but all that means is we take a fluorescing agent that is designed to attach to the DNA of the Babesia germ, and it makes it so under the microscope that germ lights up so you can see it, okay? So the FISH test is kind of looks like a live way of seeing if the germ is there, versus the antibodies measure, have you had an antibody reaction, okay? Now, antibodies can come and go. If the antibodies remain there, we would expect that they might. But if they go away, it just may mean that because of suppression, they're not being seen. So not having antibodies does not prove the infection is gone, okay? But likewise, also continuing to have antibodies means the immune system is doing what it's supposed to do and still showing ongoing reaction. In other words, especially with, or not especially, but with IgG antibodies, for instance, once you develop them, they're the memory of the immune system. You will always make those antibodies, okay? All right. FISH testing, you got to have a lot of the germ in you for it to be seen. So you can still have some of the germ in you, but maybe the FISH isn't going to detect it because it's not a large enough level to be seen under the microscope. So when it comes to treating Babesia, most of us that treat it, that treat Lyme, find the greatest success at not having relapses of treating for at least 4 to 5 months. Okay, so for 4 to 5 months. And what the rationale is behind that is that Babesia lives in your red blood cells. Red blood cells have a lifespan when they're made in the bone marrow of about 3 months, sometimes 4 months. And what we want to do is treat the new blood cells and the living blood cells, but we want to treat the living, we want to treat at least through one life cycle so that we can make sure that those existing blood cells that might be infected are not reinfecting the new blood cells, all right? So we want those blood cells to die off so that there's no chance that they could reinfect the new ones. That's kind of what the theory is behind it, all right? So I generally would treat for at least 4 to 5 months, and I want to make sure that the symptoms that look like Babesia are gone, all right? So what are those symptoms? Well, fatigue is one, but also fatigue can come from Lyme, so that's not a good one to follow. Night sweats. If people have a lot of drenching night sweats and we treat their Babesia, often that's going to go away. Other things that people might have with Babesia are panic attacks. Sometimes they have air hunger. And a very strange symptom, sometimes people with Babesia have a lot of frequent deja vu experiences. Now, not everyone does, but I find, especially when the deja vu experiences are there, that as you treat and get somebody well, the deja vu is going to go away, all right? So you want to follow the Babesia symptoms to get a clue as to whether you're done, and you want to treat for a minimum 4 to 5 months, okay? All right, thanks for the question, Pam. Hello, Geraldine. Let's see. I was bitten by a tick last year, took triple antibiotics for 11 weeks, then cat's claw and banderol tinctures for 6 months since that. A friend who has severe Lyme has been under treatment for years, is now taking disulfiram, and feels better than he has in years. He is telling me that the herbs will only suppress the Lyme, and I should go on a course of disulfiram as soon as possible. All right, so let's talk about that. So disulfiram, before I talk about disulfiram, let me talk about the Lyme germ, okay? So historically, we have thought that Lyme lived in a growing state. But we've wondered if one of the reasons that some people don't get better is if they might be developing something called persister forms of Lyme as well too, okay? So I want to describe 2 things. So Lyme can live in 2 forms. One is a spirochete, that's the corkscrew looking thing that you have seen. And then there's also another form, which is a cyst. And spirochetes can change into cyst, and cysts can change into spirochetes. Okay, so I call those the forms. In addition, Lyme has 2 growth states. There's growing forms of the germ, and then there are hibernating forms of the germ. And hibernators basically occur when the germ has been exposed to antibiotics for a while. We think that some of them can move into hibernating forms, okay? All right, so to clarify that one step further, you can have spirochetes that are in growing states and in hibernating states, or we call those persisters. You can have cysts that are in growing states or in hibernating states. We call the hibernating ones persisters, okay? Now, persister forms of the germ we know can occur. We don't know that they occur in everybody that has Lyme. We don't know, because I've treated many people that have gotten well without ever giving them something that specifically targeted a persister form. All right. Now, about 4 years ago, because we know that there are a large number of people that have a hard time recovering from Lyme on traditional antibiotics or traditional herbal antibiotics, we decided, research started being done to look and see, could Lyme have persisters? And what we discovered is it can. Okay. And one of the first studies was done out of Northeastern University in Boston. And in those studies, they were able to show that under prolonged antibiotics, some of the Lyme spirochetes and some of the Lyme cysts would turn into persister forms. Okay. And in those studies, as I remember, it was about 20% of the spirochetes and about 20% of the cysts would take on persister state. Okay. The trouble is we've never done studies in humans to show whether we really get persisters in humans, but in laboratories we do. All right. Now, about 4 years ago, also, there was some research starting to be done looking at, well, what are you going to use on persisters? And one of the labs doing research was out of Stanford University, and they discovered in their studies that disulfiram, which we use to treat alcoholism, also has the ability to treat these persisters. Okay. Now, in that study that was done out of Stanford, they only grew persister forms of the germ. They only created persisters. They did not look to see, does disulfiram treat growing Lyme? All right. So a lot of my colleagues now, based on those studies and based on the experience of a physician named Dr. Ken Ligner out east, Ligner, based on those Stanford studies, put 3 of his patients on disulfiram and had some good results and published a case report where he described what he had done with these 3 patients. And that was published in 1999 in May. And people then suddenly started using disulfiram in their treatments. All right. Ligner subsequently has now, at the last ILADS meeting in about a month and a half ago here, told us what's happened with 71 patients that he now has done this on. And what he found is in 71 patients that had been on prolonged courses of antibiotics and were not getting all the way there, he would put them on disulfiram. And around 36 or 37% of those people, he was able to get into what he calls extended remission. Maybe cured, okay, but at least into extended remission. And that means they haven't had to use any antibiotics for at least 6 months and their health is good, okay? So disulfiram appears to work well to get into remission and wipe out persisters in at least 36% of people. Not everybody though, okay, but 36% of people, all right? He also showed in his studies that around 50% of people would get bad fatigue on it, about 15% of people develop neuropathy on it, and about 30% of people develop bad psychiatric issues on it or develop some psychiatric issues on it, okay? All right. So we know from Ligner's work and we know from the Stanford University studies that disulfiram can treat persisters. And it is true if you've been treated with antibiotics that you might have developed persisters. All right, it's true. All right. But we do not know that your immune system doesn't get rid of those persisters. So for instance, if you've done antibiotics and you are symptom free, I do not agree that you necessarily need to go on disulfiram. It is possible if you are symptom free that your immune system has dealt with those persisters. All right. So it's possible. All right. So the only time that I'm using disulfiram, I'm generally reserving it for people that have done antibiotics in the past and have not gotten well enough. That tends to be who I'm using it on. There is an occasional person, though. I've got one patient in my practice that came to see me and said, I want to be put on disulfiram. And mind you, she'd never been on an antibiotic at all. She probably had Lyme for 20 years. And the only thing I put her on was disulfiram. And she's now 100% well. The question I have, though, is why would that work if we also have growing forms of Lyme? Remember I said the laboratory experiments said that it only works against persister forms, but the lab experiments didn't look to see if it deals with growing forms. So maybe, based on my experience with her, it will treat growing forms and the persister forms. And so I'm now just starting to work in my practice, asking patients, do they want to just try disulfiram alone, even if they haven't used other antibiotics, with the idea maybe it's going to be sufficient for most people that haven't even ever treated growing forms, but I'm not clear about that yet. And I've only done that with one person to know for sure if it could work. And you can't make any decisions about all people based on the experience of one person. Okay. All right. So in your situation, what I would do is if you're well and the antibiotics seem to have gotten you 100% well, you're back to a good place, then I don't think you necessarily need to do disulfiram. All right. Because it's possible your immune system would have gotten rid of these persisters. In addition, disulfiram seems, based on Ligner stats, to only get 36% of people into remission anyhow. Okay? All right. There you go. Thanks for your question, Geraldine. Hope that gives you some useful information. If you want to read more about disulfiram and these stats that I just told you, let me go ahead and I'm doing a screen share here. I'm going to show you my recent article that I published on this. All right, so let's see here. Take a look at my latest articles here, and I always keep up to date on what the latest thing is I published. Here's my disulfiram article. It's Disulfiram for Lyme Update. This is a rewrite and a reshoot. I redid a video on this based on my latest experience working with it. And in here, I put the Ligner statistics, which are very similar to what I'm seeing in my practice, okay? All right. Thanks for your question, Geraldine. Good luck to you. Hello, Geraldine. Let's see. I read that taking glucosamine as a supplement is not a good idea as it will feed the Lyme, as will sugar. I disagree. There have been no studies done looking at does glucosamine feed Lyme. There isn't a study done, okay? I will also relate to experience in my practice. So it is true if you give sugar, which would be sucrose, fructose, those kind of sugars, to yeast, it will feed them. But that's not the case in what I see with glucosamine. Glucosamine, many of you know, is a building block for cartilage. And sometimes when people have Lyme, their cartilage gets injured in their joints because of Lyme. And that can result in one of the reasons people have joint pain. What happens is if you get injury to the cartilage, so cartilage covers your bones in the joints and it makes it so bones can glide over each other easily in a joint. But if that cartilage gets damaged, you wind up getting bone rubbing on bone. That leads to inflammation, okay? So if I've got somebody that I've been treating their Lyme and their knee pain is just stuck in place, or they've got some other joint that's just not budging, at times I will try to rebuild the cartilage in the joint using glucosamine, okay? And I see that it helps maybe about 70% of the time in these situations. And that's use glucosamine sulfate, 500 milligrams 3 times a day. When I've used it, I have never seen a decline in their Lyme symptoms, never, okay? So I don't buy the idea, and somebody came up with that idea, but there is no studies to back that at all, all right? Thanks for the question, Geraldine. Hello, let's see. I already answered the first part of that question. Hi, Sandra. Let's see, have you heard of Lyme or Babesiosis calling elevated GAD6 autoantibodies? No, I'm not familiar with what a GAD65 is, okay? Which tick illnesses cause severe neuropathy in the calves, burning feet, muscle aches, muscle loss, and dull pressure headaches? How best to treat? Do you ever get over Lyme, or do you just suppress these bacteria? Thank you. All right. So in terms of neuropathy and the kind of symptoms that you're listing here, which would be muscle aches, muscle loss, and dull pressure headaches, this could be either Lyme or Bartonella. It tends to be what I see, okay? And in terms of how to treat those, it kind of is extensive. I would take a look at, I'll point you to look at a few things here in a minute in terms of my website, okay? All right. So in terms of your question, do you ever get over Lyme? Do you suppress these? So I think in 85 to 90% of the time, we can wipe out Bartonella. I think 85 to 90% of the time, we can wipe out Babesia. In terms of the Lyme germ, I do think that about 85 to maybe even 90% of the time, we don't wipe the germ out, we put it into remission. My standard is if I've treated somebody and they remain symptom-free after I stop treating them for at least 2 years, I think I have cured them. That is a viewpoint that has been raised in a number of Lyme forums with other Lyme doctors that have a similar opinion as that too. Okay. All right. Those are just my thoughts on it. All right. All right. So let me just do a quick screen share here for you. Okay. So in terms of how are you going to treat the Lyme and the Bartonella and the Babesia, take a look at my infection treatment plan section here. An article about what do you use to kill Lyme, article about what do you use to treat Bartonella, another article down here about what do you use to treat Babesia. Okay, the way to put it all together in terms of a comprehensive approach, which involves more than just killing the germs but correcting all the abnormalities, is under my treatment protocol tab, where I walk you through ways that I have found helpful to treat people with Lyme. Begins with getting sleep. I talk about diet. I talk about lowering the inflammation cytokines that I've told you about, and I give you an idea on how to do it. My protocol deals with things to help your adrenal and thyroid work better. That's using an adaptogen. You need to correct your hormonal problems. You want to be on a good multivitamin, support detox, exercise if you can. Doing all those steps will boost your immune system, get yeast out if it's there, and then also as part of it, treat Lyme infection and treat your co-infections, okay? Those are the key steps to recovering from Lyme disease. So as you can tell, it's not just about killing your germs. You got to do a bunch of stuff to support the problems created by those infections, okay? All right. Sandra, thank you for that question. Good luck to you. All right. Hello, Caroline. Let's see. What is the most accurate test for Lyme disease and for babesiosis? All right. So for Lyme disease, increasingly, I'm relying on a test that was created by IGeneX. IGeneX is the tick-borne specialty lab out of California. They have a test called a Lyme immunoblot, which is a bit of a different take on what they used to call their Western blot, which they still do. Okay, so immunoblots, Western blots, what the heck is all this stuff? Let me talk about the differences, okay? So in a Western blot, which is the test that I used to do often, a Western blot method of seeing if you have Lyme can find Lyme if it's there about 80% of the time. The new immunoblot technique that is done by IGeneX, based on their validation studies where they went out and looked to see how good is their test. Okay, they actually tested the test. And that the test will find Lyme if it's there about 95% of the time. Okay, so the old Western blot that IGeneX did would find it 80% of the time. The new immunoblot will find it 95% of the time. And that's based on proof or validation studies that IGeneX has done. And it reflects, I think, my experience here as well, too. All right, so let's talk about what these do. So both a Western blot and an immunoblot are looking to see, is your immune system making antibodies that attach to the germ? Okay. In the Western blot, the old Western blot, which you can still get a Western blot, but the old Western blot, the way we would see it, that IGeneX would do this is they would grow 2 strains of Lyme germ in the lab, all right? And then they would kill the Lyme germ, take its proteins, spread it out on a test strip, and see if you had antibodies that would react to the different proteins. And they would run electricity through that test strip so that all the proteins that weigh the same fall out in the same position or band. You probably have heard that word band. And what that is all the proteins that weigh the same locate themselves in the same band. So there's a band 39, for instance, and that happens to be all the proteins that weigh 39 kilodaltons from those 2 families of Lyme germs will locate in the same place on the test strip. All right. All right. So the Western blot looks to see if you have antibodies against 2 kinds of Lyme. The immunoblot looks to see if you have antibodies against 8 kinds of Lyme. All right. Do you already see why this might be a better test? It's looking to see if you have antibodies against more kinds, okay? The other thing that's nice about the immunoblot that's being done by Agenics, or that Agenics came up with, is instead of what they do to create those proteins is they've taken the proteins from these 8 different kinds of Lyme and they have genetically modified them. And they grow the proteins in bacteria in the lab to produce genetically modified proteins. And the reason they've done genetic modifications and what they do with the modifications is they remove parts of the proteins that could hold on to antibodies that are made against viruses. All right. So one of the problems with the Western blot is when you get antibodies stuck on Lyme proteins, for some of those proteins, they could also be antibodies that were made against virus infections, like Epstein-Barr, the monovirus, human herpes virus type 6. Sometimes the antibodies we make against those viruses can cross-react with parts of the Lyme proteins, okay? So you get a false positive test. With the new immunoblot, because they're using cleaned out proteins, if you will, you don't get false positives. So the other thing that's good about the immunoblot that I like is you don't have false positives. If that test comes back positive, it's because you got Lyme in you, okay? So I like the immunoblot. It will find it if you have it in you 95% of the time, and which is better than even the ELISpot. The ELISpot that is done by places like Armin Labs has a sensitivity, the ability to find it of maybe 85% at best, okay? So your best test is the Igenics immunoblot for Lyme, all right? Thanks for the question. Oh, if you need more information about this, let me just do a quick screen share here on that one. All right, so back at Treat Lyme by Marty Ross MD, take a look at my online Lyme guide. Take a look at the section called Test. And there actually is an article I have where I grade the different ways of looking at Lyme to see if you have Lyme, okay? And I put the immunoblot information in there too. All right, thanks for that question. Hello, Lynn. Let's see. Hi, Dr. Ross. Can I take my ATP 360 as a divided dose, or is it better to take all 3 pills at once? Let's see. Also, on another seminar, you mentioned needing to take carnitine if not eating red meat. Do I need to take it if I eat chicken and fish but not red meat? All right. So ATP 360. So everyone, when you have Lyme disease, one of the things that can happen that can make it so you have low energy is that your energy factories in your cells, which are called mitochondria, can get injured, okay? So every one of our cells has about 300 to 400 mitochondria. And in the mitochondria, sugar and fat are burned through a bunch of chemical reactions to make cell fuel, which is a chemical called ATP. Now, the covering of the mitochondria is a double layer of fat, and our fatty acids are fat, okay? What happens in Lyme when you have chronic infection, or if you have mold toxins in you, there's an overproduction of oxidizing agents by the immune system. And those oxidizing agents can damage fat membranes, including the fat membranes that make up your mitochondria. Now, you need a healthy functioning fat membrane for 2 reasons. Number one, the healthy fat membrane helps to get sugar and fat to the inside. And if it's damaged, you have a more difficult time getting the fuel sources for the mitochondria, which is sugar and fat, into the mitochondria, okay? So you have poor fuel uptake, okay? Number 2, the mitochondria membrane donates electrons into some of the chemical reactions that are critical to create the cell energy, all right? Now, the way that fat gets to the inside of mitochondria is it has to be carried to the inside through the fat membrane using a transport vehicle, which is called carnitine, okay? All right. So when I've got somebody that has mitochondria or an ongoing fatigue, and we're about 6 months, 9 months into treatment, we're not making any headway with their energy, that's when I'm going to start thinking about repairing mitochondria. And the one thing I like to do is repair the fat membrane. ATP 360 is something I will use. It's made up of the fats that are found in the fat membrane of the mitochondria. The recommended dose is 3 pills 1 time a day. You could take it as 1 pill 3 times a day too, but the recommended way is 3 pills 1 time a day, okay? Now, if you don't eat red meat, you're probably going to be low on carnitine, which is the transport vehicle that carries fat to the inside. So, in people that are vegetarian, that are not eating red meat, by red meat I mean lamb and beef, if you're not having adequate sources of red meat, you're probably going to be low on carnitine. And in that case, I like to supplement that. And to do that, I like using a form of carnitine, which is called acetyl L-carnitine. Thorne makes a product called Carnitil, which is acetyl L-carnitine, 500 milligrams twice a day for 1 month, and then I decrease it down to a 1 pill a day after that, okay? Now, the ATP 360, you need to be aware of something. If you are somebody that is using atovaquone found in Mepron or found in Malarone to treat your Babesia, you do not want to take ATP 360 because it also has some micronutrients in it, including CoQ10. And CoQ10 interferes with the atovaquone. If that is the situation, instead of using ATP 360, then I suggest using another product by Research Nutritionals, which is called NT Factor. NT Factor also has these fats that make up the covering of the mitochondria, but it does not have any CoQ10. And if you're going to use the NT Factor, you want to do 2 pills 3 times a day for 2 months, and then you want to stop it and then use it as 1 pill 3 times a day for another 4 months after that. Okay? All right. Let me see if I answered all your questions here. I think I answered your questions. All right. Good luck to you, Lynn. Thanks for the question. Hello, Lynn. Say hi, Dr. Ross. Question about my 20-year-old son who had chronic Lyme, Barton, and Babs for years as a child and through middle school. His recent blood work came back with flags on his lipid panel as high cholesterol at 208, triglycerides high at 114, HDL normal at 61, VDL cholesterol at 23, LDL high at 124, and T cholesterol ratio normal at 3.4. Also, his bilirubin was flagged high at 1.6. He has had 2 docs look at these, and one says it is normal for a 20-year-old, and the other expressed concern. Both are integrated medical docs. Can you please weigh in? His lipid panel was like this when he was 12 and dealing with Lyme, Barton, Babs, so I wonder what the implications are for that. He is 6 feet tall and slender, but his dad had 2 heart attacks in his 40s, and there is a history in the family. Thank you. I'm just looking back at the numbers here. All right, so the whole area of whether to treat high cholesterol is controversial. Okay, I'll just start by saying that. So first of all, I do not think that Lyme, Bart, or Babesia would have triggered high cholesterol, nor do I think any of the medications would have, okay? All right. Then one of the things that I try to do when somebody has elevated cholesterol is to look at what a family history is. And if there is a family history of increased heart disease, then in general, you probably want to try to be a little bit more careful at keeping cholesterol levels down, okay? All right, now, the trend in medicine is to try to keep the LDL cholesterol, which is more associated with heart disease, at 100 or lower. Okay, that's the trend, okay? And to do that, we often resort to using medicines that are statins to lower it down. There is good information to show that if you are on statins, it could lead to other illnesses, all right? And although you may limit heart attacks, it still seems that people don't live any longer. They just die of other causes, basically, all right? So for instance, the Canadian doctors generally are skeptical about using treating with statins for LDL cholesterol because they're concerned that it could lead to other health problems. And I actually fall in that same camp. And I will tell you that I individualize my treatment for each person. So The HDL cholesterol above 60 can protect against heart disease. The LDL at high at 124 is above 100. I probably would also want to look at something called a C-reactive protein. If the C-reactive protein is elevated, we know that increased inflammation coupled with an LDL above 100 in a family with heart disease is an increased risk of having heart disease. And that's a situation where I might try to treat, okay? So I would suggest there's another piece of information you want to get here. You want to see, is there inflammation associated with this? And if the C-reactive protein is elevated, that says there's inflammation. And it's actually inflammation with elevated cholesterol that can create problems, okay? All right, I think I answered that question for you. So good luck to you. Good luck to your son. Hello, Lori. Hi, Dr. Ross. Thanks for all you do. What supplements do you recommend for daily maintenance for those of us who are compromised to take to help the immune system through this pandemic and is good daily maintenance for those of us who are feeling pretty good? All right, so a couple of things. Number one, I'm advising that people take vitamin D, especially as we move into the cloud cover months here. Vitamin D has some good data that shows that it can help your innate immune system, which is the part of the immune system that has to deal with infections we've never seen before. All right, it hasn't been trained to deal with the coronavirus, for instance. There's good information that shows vitamin D levels. Vitamin D can help your innate immune system work better. There's also a number of studies that show that vitamin D levels, if they're adequate, will help can help you treat viral infections in general, okay? Also, it's of interest, there were some studies done looking at homeless people who we thought COVID-19 would go crazy in, but it appears that homeless people have less trouble with COVID-19. And one of the reasons is postulated is maybe they have elevated vitamin D because they're outside so much where sun is hitting their skin and converting them into having healthy levels of vitamin D, okay? All right, so I recommend vitamin D, usually 5,000 international units one time a day. The other thing I like to have people on is reishi mushrooms. Reishi mushrooms are shown to be beneficial against viruses at turning on the innate immune system. And I like using reishi, and what mushrooms have in them is a type of sugar called beta-glucans. And beta-glucans are shown to turn on the cellular part of your immune system. That's the cells that fight infection, including those that are found within the innate immune system, the part of the immune system that fights Lyme up front, okay? And I would do reishi mushrooms as 400 milligrams 2 or 3 times a day. And then finally, I like to have people on transfer factor multi-immune. That product by Research Nutritionals is shown to turn on natural killer cells that are part of the innate immune system to fight virus infections as well. And with that, I'd like to do 1 pill twice a day. So there's 3 essential things, I think, in my opinion, not backed by any research. I want you to know because no one's done research on this in coronavirus or COVID-19. But I like to be on vitamin D, 5,000 international units a day, reishi mushrooms, 400 milligrams twice a day, and then this product called Transfer Factor Multi-Immune by Research Nutritionals. It's got some good science showing it shows really marked elevations in natural killer cells that can fight acute viruses. And that's based on their research, okay? And that is a pill twice a day. Transfer Factor Multi-Immune by Research Nutritionals, okay? All right. Thanks for your question, Lord. Hello, Tatiana. What are your suggestions on treating Lyme and Bartonella during pregnancy to reduce transmission? Are any antibiotics successful, or can herb be taken to reduce transmission as well? Okay. So there are no herbs that have been studied and shown to reduce transmission. Basically, there's no herbs that have been studied. There's no study that's been designed to say, can herbs reduce transmission? Okay. So I can't answer the question on that. In addition, there are not adequate safety studies to show that the herbal antibiotics we might use for Lyme and Bartonella are safe to use for a growing or developing baby, okay? So generally, if I'm going to try to use something to prevent transmission in pregnancy, I'm going to use antibiotics. Now, we do not have any studies that have been designed that are actually performed as studies where we recruit women that are pregnant and put some on antibiotics and some not on antibiotics when they have Lyme or Bartonella and see if the antibiotics work. None of those studies have ever been done. What we do know is based upon a pregnancy registry that was kept in Connecticut in the late 80s, early 90s, where women that had Lyme we had information that was collected about them, not in a formal research study, but just information was collected. And what we know from that pregnancy registry is that if a woman had Lyme during pregnancy and she was not on antibiotics, that that there was a 50% risk that her baby would develop Lyme. Okay, but if she was on antibiotics during pregnancy for her Lyme, that the transmission for Lyme went to 0. All right, so many of us have taken that as an information that suggests we can put people on antibiotics that are safe for the mom and the baby to prevent Lyme transmission. In that registry, there was no information kept about Bartonella, and we actually don't have any studies about Bartonella or any registries, okay? There is some concern that Bartonella could be transmitted in pregnancy, but again, we don't have any proof of that. And so if I've got a woman that has inadequately treated Bartonella and active Lyme in pregnancy, I'm going to want to wind up putting them on at least 1 or 2 antibiotics. One of the antibiotics that you can use in pregnancy that's safe, that can also work on Lyme and Bartonella, is azithromycin. So I sometimes will put them on that. If they don't have Bartonella, then I'll work with either azithromycin during pregnancy or amoxicillin during pregnancy, or on something called cefuroxime. Okay, all right. So let me just show you a quick article where you can look at some of the pregnancy dosing I was just talking or about these antibiotics. Let's see here. All right. So take a look at my section on pregnancy. And in here, I talk about issues related to pregnancy, can your baby get it, et cetera. And in here, I talk about the antibiotics I would use and how to dose them, okay? Ooh, starting to get a little yawny here, actually. All right. Thanks for your question, Tatiana. Good luck to you. Hello, Kristen. Let's see. Trying to get brief. 15-year-old. Oh, I appreciate that. I think she meant trying to have a brief question because I asked everyone to write shorter questions. Let's see. A 15-year-old with Lyme and Bartonella Galaxy positive for 3 years. Was getting better on clarithromycin and rifabutin. Got virus, fever, high ferritin, anemia, neutropenia, etc. Ended up in the hospital in July for my GI X-ray showed suspected Crohn's. Turns out it's lymph nodes, thinking BART and new EBV mesenteric lymphadenitis. Other than treating BART, how do I handle this? SIBO, leaky gut, PANS, etc. Okay, so this is a person, so to rephrase this, Kristen's been treated for Bartonella with clarithromycin and rifabutin, and she has laboratory evidence she has Bartonella based on Galaxy Labs that does a PCR DNA test that can prove if you have living Bartonella in you, okay? But she eventually got sick with a lot of abdominal problems, it looks like, and in the end, based on studies, they were wondering if she might have Crohn's disease, but in the end, based on studies, it looks like they found that she had swollen lymph nodes, all right? Now, swollen lymph nodes can be part of Bartonella. But she's also wondering, I think, if that, is there anything else that could be causing this? And the answer is, I would think mostly Bartonella. I don't look at EBV as giving you this kind of lymphadenitis, although I guess it could. But the two things I think I would focus on would be Bartonella and the Epstein-Barr virus. I don't think that you're going to find benefit at looking at leaky gut, PANS, SIBO, et cetera. Just focus on those two things, okay? All right. Good luck to you, Kristen. Hello, let's see. Does Bartonella patient have sweating day and night too? So night sweats often we associate with Babesia. Increased day sweating can be part of Bartonella. Those are just the general guidelines, okay? However, to be honest with you, I sometimes see crossover. Sometimes I'll see people with Babesia getting day sweats, and sometimes I'll see people with Bartonella getting night sweats, all right? So it could be either way, all right? Good luck to you. Hold on here, everyone. Hello. Oh, let me try that again. Hello, Brenda. Let's see. Thank you for these webinars. This year, do you recommend people under 65 with active chronic Lyme get a flu shot? 2, can you please share the reasons you recommend treating Lyme before Bartonella? Okay, I'll answer the second part first. So I don't recommend treating Lyme before Bartonella. I recommend treating Lyme and Bartonella at the same time. I think you may be misunderstanding some other statements I made. So if somebody has Lyme, Bartonella, and Babesia, I recommend treating Lyme and Bartonella and getting Bartonella under control, or at least improving, before you add in a Babesia treatment. And the reason for that is based on my experience, but also the experience of Burriscano. Many of you know the name Burriscano. He's one of the Lyme pioneers in the country that used to treat Lyme out in New York State. His observation after treating thousands of people with Lyme and Bartonella is if you tried to treat Babesia before getting Bartonella under control, it became very difficult to get rid of Bartonella. Okay, that's my experience too. So I usually, and you can treat Lyme and Bartonella at the same time. There's no problem doing that. But if I've got somebody that has Lyme, Bartonella, Babesia, usually, unless the Babesia is so debilitating, usually I'm going to treat for Lyme and Bartonella first. Okay, all right. Then flu vaccine's tricky this year. All right, so the flu vaccine generally only works about 50% of the time. All right. And we have to weigh out risk and benefits when we decide if we're going to give it. So the benefits of getting the flu vaccine is it can prevent you getting flu 50% of the time. But if you are somebody with active Lyme, we see that Lyme gets more active, worse, when you're given the flu vaccine, often. Not all the time, but often, okay? So in a normal season where we didn't have COVID-19 floating out there, I usually don't recommend the flu vaccine because I only find it to work 50% of the time. And often people get worsening of their Lyme, and I don't think it's worth it. Okay, now, this year is a different ballgame. And this year we have to worry about COVID-19. And the last thing you would want to get this year is COVID-19 and the flu at the same time. All right. So this year I give people information and I let them make their own decision. If it were me, generally, I would lean in the direction probably of getting the flu vaccine this year because of COVID-19 being out there, okay? And that's in somebody under age 65, okay? All right, that's just this year, all right? All right. Thanks for that question, Brenda. Good luck to you. All right, that's it, guys. So it's been good being with you here again. I'm glad that the webinar worked. I now have to figure out after I hang up whether I actually got a recording out of it because, again, I usually record to YouTube, but for some reason I just cannot get the YouTube channel to connect today. And so I'm going to have to see if my webinar provider recorded this in another way, and I think they do, but I have to figure out how I'm going to get that edited and out to you tomorrow. So I hope I have it. But in either way, I will send out an email tomorrow morning after I get the webinar edited, or if I don't have it edited, I will send out an email letting you know I wasn't able to do that. And now I need to spend this next week trying to figure out how I'm going to get YouTube reconnected. So we'll see how that all goes. All right. Thanks for being here tonight. I hope we do have a recording for you tomorrow. In that email that you get tomorrow morning, you'll have a link to the recording. And in addition, I will wind up including links to sign up for next week's webinar because we will have a webinar next week too. All right. good to see everyone tonight. I'm glad you all made it back here again. And good luck with this week ahead. Okay, bye-bye.